Acceptance and commitment therapy, known as ACT and pronounced like the word ACT, is a psychological framework that helps individuals build psychological flexibility. And psychological flexibility is the ability to stay present, to open up to difficult experiences, and to take meaningful action guided by our deepest values. Rather than focusing on eliminating symptoms, ACT helps people live richer, more vital lives, even in the presence of pain, fear, or uncertainty. Developed in the 1980s and 90s by Stephen Hayes and Kelly Wilson, ACT emerged from the work of behavioral analysis and the study of human language and cognition. But it also draws philosophical and therapeutic influence from existentialism, humanism, and Gestalt therapy. What makes ACT or ACT distinct is that it does not treat painful thoughts or emotions as enemies to be conquered, but rather as experiences to be carried in a different way, held a little bit more lightly, acted on a little bit less rigidly, and met with greater self-compassion. Acceptance and commitment therapy is structured around 6 interwoven processes that collectively come together to cultivate psychological flexibility. First is acceptance, which involves opening up to difficult thoughts and emotions rather than avoiding or resisting them. It's not a passive resignation, but an active, courageous willingness to feel discomfort in service of what's really important. The next is cognitive diffusion, which teaches the client to observe their thoughts as mental events, not as truths that should dictate behavior. So a person may go from thinking quote, I'm such a failure to, quote, I'm noticing the thought that I'm a failure, which is a subtle but liberating shift. Third is present moment awareness, also known as mindfulness. And this is the ability to pay attention to what is happening right now with openness and curiosity, rather than getting lost in rumination or fear. The fourth concept is self as context. And this is the idea that we are not our thoughts and our feelings, but the consciousness that holds and experiences them, right? And so if we have these negative thoughts, it's about realizing that they come and they go, and there's a deeper, more essential part of who, ourself, that is the one that can experience the thoughts and then can also let them go. This flexible sense of self allows people to develop the space needed for self-compassion, resilience, and empathy. Fifth is values clarification. And this is where the therapist helps the client articulate their core values, the rules and principles that they want to live by, the qualities of being that matter deeply to them, like authenticity, love, creativity, or integrity, to name a few. Finally, committed action means taking concrete steps guided by those initial values, even when there's obstacles or discomfort in the way. Unlike many traditional therapies, acceptance and commitment therapy does not attempt to control or reduce internal experiences directly. It doesn't ask whether a thought is true, but whether it's useful and moving us towards our values. Instead of trying to fix a client's thinking, acceptance and commitment asks whether they can relate differently to their thoughts and still move towards the life they want. So, for example, a therapist may use the metaphor of quicksand. So the more you struggle, the more stuck you seem to become, which suggests that fighting with anxiety often reinforces it. ACT therapy often uses these types of metaphors or mindfulness exercises or experiential activities, all designed to help clients develop cognitive flexibility and to be able to respond to their pain and discomfort with more openness and choice. It may borrow techniques from behavioral activation, exposure therapy, but it always has the aim of fostering movement towards valued living, not simply just reducing distress. So the goal is not just to become less stressful, but it's to take our stress and use it to move towards a more meaningful life. And the side effect of that is distress tends to decrease. So the therapeutic relationship in an ACT is non-hierarchical, and it's very much collaborative. Therapists do not position themselves as experts who fix a broken client. Rather, they share in the common human struggle with thoughts, language, and avoidance. The therapist models presence, acceptance, and non-defensiveness in the relationship itself, which offers the client a sort of living experience and a living model of what psychological flexibility really is. ACT assumes that people are not broken or disordered, but they often find themselves stuck in patterns of avoidance and fusion with unhelpful beliefs. The work is not about repair, but about liberation, about reconnecting the client to their most deepest and important values, and developing new habits of awareness and learning to walk forward even when storms are present. Acceptance and commitment therapy has been shown to be effective in treating a wide range of issues, from depression, anxiety, PTSD, substance use, chronic pain, and even more. And in my practice, I've seen it really be helpful in developing, say, a young adult's, they're developing their own perspective on the world, and they might be ready to start disconnecting or deviating from their family of origins perspective. And a big part of that is, well, accepting their origins, but then also moving towards their important values. And so ACT offers a deeply human vision that life's pain need not be avoided or silenced, but can be carried with dignity and courage as we move towards what matters most. Let me know what you guys think about this theory in the comments below, and I'd love to hear your thoughts. If there's anything that's helpful, anything that stood out to you, do you use this in your work with clients? I'd be curious to know. Thanks.